Which of the following describes the Bernoulli equation application in assessing a VSD via echocardiography? A. It calculates the total volume of the heart. B. It determines the valve area of the mitral valve. C. It converts the peak velocity of the VSD jet into a pressure gradient. D. It measures the thickness of the interventricular septum. Answer: C. It converts the peak velocity of the VSD jet into a pressure gradient. In a patient with a large VSD, why might the S2 heart sound be widely split? A. Delayed closure of the aortic valve. B. Earlier closure of the aortic valve and delayed closure of the pulmonary valve. C. Permanent closure of the tricuspid valve. D. Rapid heart rate only. Answer: B. Earlier closure of the aortic valve and delayed closure of the pulmonary valve. Which of the following is the most common associated anomaly found in patients with a supracrystal, subpulmonic, VSD? A. Coarctation of the aorta. B. Mitral valve prolapse. C. Aortic valve prolapse and aortic regurgitation. D. Persistent left superior vena cava. Answer: C. Aortic valve prolapse and aortic regurgitation. A non-restrictive VSD is characterized by which of the following hemodynamic states? A. Equalization of pressures between the left and right ventricles. B. A very high-pitched, loud murmur. C. Minimal pulmonary blood flow. D. Normal pulmonary artery pressures. Answer: A. Equalization of pressures between the left and right ventricles. What is the pharmacological rationale for using an ACE inhibitor in a child with a large left-to-right shunt? A. To increase pulmonary vascular resistance. B. To decrease systemic vascular resistance, afterload, favoring systemic flow over the shunt. C. To increase the heart rate. D. To close the VSD primarily. Answer: B. To decrease systemic vascular resistance, afterload, favoring systemic flow over the shunt. Which surgical procedure is typically performed as a palliative measure in infants with multiple VSDs who are too small for a full repair? A. Fontan procedure. B. Blalock-Taussig shunt. C. Pulmonary artery banding. D. Glenn shunt. Answer: C. Pulmonary artery banding. In an adult with a small, asymptomatic paramembranous VSD, what is the most likely long-term outcome? A. Progression to Eisenmenger syndrome. B. Immediate heart failure in the third decade. C. Normal life expectancy with a small risk of endocarditis. D. Spontaneous rupture of the septum. Answer: C. Normal life expectancy with a small risk of endocarditis. Which of the following is a cyanotic heart defect that includes a VSD as a core component? A. Atrial septal defect. B. Patent ductus arteriosus. C. Double outlet right ventricle, DORV. D. Coarctation of the aorta. Answer: C. Double outlet right ventricle, DORV. What is the typical orientation of the inlet VSD relative to the conduction system? A. The AV node and bundle of his are located superior to the defect. B. The conduction system is completely absent. C. The bundle of his is located on the anterior rim. D. The AV node is displaced posteriorly and inferiorly. Answer: D. The AV node is displaced posteriorly and inferiorly. Which auscultatory finding would suggest that a VSD is decreasing in size or becoming more restrictive? A. The murmur becomes softer and lower pitched. B. The murmur becomes louder and higher pitched. C. The murmur disappears completely. D. The murmur becomes diastolic. Answer: B. The murmur becomes louder and higher pitched. A residual shunt after surgical VSD repair is most commonly detected by which method? A. Palpating the chest wall. B. Routine chest X-ray. C. Color Doppler echocardiography. D. Change in skin color. Answer: C. Color Doppler echocardiography. What is the primary reason for performing a hybrid VSD closure, surgery plus interventional cardiology? A. To save time in the OR. B. To close muscular VSDs that are difficult to reach via traditional surgery. C. To avoid using anesthesia. D. To treat endocarditis simultaneously. Answer: B. To close muscular VSDs that are difficult to reach via traditional surgery. Which of the following is not a risk factor for the development of VSD? A. Maternal diabetes. B. Fetal alcohol syndrome. C. Maternal exposure to anti-seizure medications. D. Maternal high-protein diet. Answer: D. Maternal high-protein diet. In patients with VSD, what does QP represent in the ratio QP/QS? A. Pulmonary blood flow. B. Systemic blood flow. C. Pressure in the aorta. D. Pulmonary vascular resistance. Answer: A. Pulmonary blood flow. Which of the following is a classic ECG finding in a patient with a supracrystal VSD? A. Extreme right axis deviation. B. Normal ECG in 100% of cases. C. Possible right bundle branch block, RBBB. D. Delta waves. Answer: C. Possible right bundle branch block, RBBB.